Madam Speaker, quick access to good health care, including emergency rooms, operating rooms, and ICUs, is essential. ERs are being closed, and already the median wait time in March is at more than 2 hours, up from 1.4 hours in October. But that plan is also to close operating rooms and intensive care units. Concordia Hospital specializes in hip and knee replacements, which can have complications. And if the ICU at Concordia is closed, patients will have to be moved post-op to another hospital. Is the government planning to close the ICUs and operating rooms at Concordia and Seven Oaks, as well as their emergency rooms?
The Honourable Minister of Health, Seniors and Active Living.
Well, Madam Speaker, the member is correct. Quick access to care is important. That's why we're pleased to see after phase one that when we compare the times of the wait times at the beginning of the transformation to now, recognizing it's still early, they are down 16%, Madam Speaker. That represents hundreds of hours, thousands of hours that Manitobans are not waiting in an emergency room. Quick access is important. If the member truly cared about quick access, he would have supported the plan, Madam Speaker.
The Honourable Member for River Heights on a supplementary question.
Madam Speaker, as the Minister and the government well know, this year the federal government is transferring record amounts of funds to the province of Manitoba, including for health. And yet waiting times at emergency rooms are too long, and waiting times for hip and knee surgeries are getting longer, not shorter. Manitobans have a right to know what this government has planned. With closures of ICUs, ERs, and possibly ORs, how are hip and knee surgery wait times going to be shortened?
The Honourable Minister of Health, Seniors and Active Living.
Well, Madam Speaker, the member continues his defense of Ottawa. He continues to fail to represent Manitobans and continues to represent and defend the federal Liberal government, the very same federal Liberal government that ran in the last election on having all the premiers come together and have a national discussion and negotiation on the future of healthcare when it comes to funding from the federal government, where they've gone from a 50% partner to a 19% partner. They reduced the funding by $2.2 billion over what was expected. They didn't have that national discussion. They refused to discuss it. The Prime Minister did with the premiers. And that member today, still 2 years after, continues to defend a cut the funding to healthcare in Manitoba. He should be ashamed of himself, Madam Speaker.
The Honourable Member for River Heights on a final supplementary.
Yeah, Madam Speaker, if the blame game were an Olympic sport, the Minister would be working hard to try and get there. The government has a credibility gap. Wait times across our system are too long.
Order.
In rural areas, for example, ambulance stations are being closed. As I heard last week in Boissevain, if its ambulance station is closed, some Manitobans will be more than half an hour from an ambulance, especially in winter. Now, this government has made its formal commitment and promise that cannabis will be available to any Manitoban within a 30-minute drive. I ask, why is this government more committed to ensuring Manitobans have better access to cannabis than they have to health care?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, I've been accused of many things. This is the first time I'm being accused of being an Olympic athlete, Madam Speaker. It's never too late, but it might be a little bit late for me. But Madam Speaker, you know, the member talks about the federal Liberal government deciding to legalize cannabis. The federal Liberal government that hasn't given proper time, proper consideration to the provincial governments, a unified position among provinces that there should be more time, because we know of the harm that it can cause for young people, particularly those 25 and under. Our Premier, our Minister of Justice, took the lead nationally to ask for more time to ensure that we really could have the right plan to protect young people. We all stood up in defense of that. That member sat and said nothing, Madam Speaker.